Good morning. I am Dr. Terry Thompson, and I am a postdoctoral fellow in the Department of Environmental Medicine and Public Health at the Icahn School of Medicine at Mount Sinai. It is my extreme honor and privilege to serve as the moderator of the 4th Clinical Climate Change Conference organized by the Institute for Episomic Research here at Mount Sinai. This annual continuing medical education conference is designed to provide clinicians with the news that they can use, evidence-based solutions and tools that will help them improve their practice now and adapt it to better serve their patients. Today, we will learn about government efforts to address current health inequities and hear about the latest research on climate and health. We are also reaching outside of the medical community to learn from effective messengers and community advocates. Each year, we focus the program on a pressing aspect of the health and climate change, particularly where we see a gap in literature and training. Today, we will look at mental health, not just for our patients, but also ourselves as healthcare professionals. Anxiety about the future of our planet is real, but more urgently, we know there is a real awareness and mental exhaustion brought on by the reality of our already changing environments. Clinicians see the effects of climate change every day. There's increased respiratory illnesses, cardiovascular disease, and heat-related illnesses. And it is key that we also recognize and address the mental toll so many are facing. This is not a future problem. It is here and it's now. I am pleased to recognize and welcome those who are joining from near and afar, including representatives from our many supporting organizations. They are the American Lung Association, the American Public Health Association, the New England Journal of Medicine, the Center for Earth Ethics at the Union Theological Seminary, Columbia's Global Consortium on Climate and Health Education, the Yale Program on Healthcare Environmental Sustainability, the Center for Health Equity, Education, and Advocacy at the Cambridge Health Alliance, and the Medical Society Consortium on Climate and Health. Many are represented in today's presentations. I am also pleased to share with you that we have attendance from health professionals across specialties, as well as representatives from nonprofit and government. You will get to meet one another in the afternoon workshops, and I'm delighted to welcome you all now. I started my career in healthcare some 20 years ago, working with Black men assessing care in health clinics in Chicago. It was clear then that they lacked the necessary information and resources and were facing an uphill battle to get the care they so needed. They were facing unemployment, health challenges, as well as homelessness. Climate change was the least of their worries. But now, today, we know that marginalized groups are more likely to bear the brunt of the health impacts of the climate crisis. And these are issues, and they are serious and impact all socioeconomic groups, not just the most marginalized. Our theme today is mental health effects of the climate crisis, also known as eco-anxiety, and none of us are immune. Today, we will talk about this serious seismic problem and together work toward a solution. Healthcare practitioners need real solutions to better care for their patients. And I'd extend the metaphor that we, as professionals, need to put the oxygen mask on first and practice some self-care. However, before we get started, I need to mention a few housekeeping items. If you're seeking CME credits, please complete the pre-evaluation form accessible as a link on your screen under the resource tab. There will be live transcription, and at the bottom of the video player, you can select subtitles in English or Spanish and adjust the size of the player as needed. We will also share the recorded videos as soon as they are available. However, if you have any accessibility needs, please let us know. Hopefully, we will minimize technical glitches, but if they happen, we recommend refreshing your browser. If you exit the player, you will need the unique registration ID number provided by the email. Also, the conference will be live tweeted today from @SinaiEpisomics. Climate changes health is the hashtag. All of our speakers have completed conflict of interest forms, and there are no commercial disclosures to be made. I have the job of keeping us on time this morning. So please submit your questions using the Q&A feature, and we will get to as many as possible as time allows. However, if we're not able to get to your question, I'd like to invite you to sign up for the New England Journal of Medicine Residence 360. This is an online discussion forum. Several of our speakers will be on deck next week to answer your questions and continue the discussions we began today. I will keep introductions brief, so please refer to the longer bios available through the resource tab. I'm excited. Let's get started.